Alright, ready?
Good.
Ready.
Okay, so what is the first thing that you think of when you hear the word mental illness?
Crazy.
Paralysis. Psycho.
Stereotype?
Retarded.
So now you need an actual crazy person. I'll be your crazy person. I'm called happy, but I've been one of the saddest people I've ever known. I started to experience depression when I was about probably 10 or 11 years old. And I didn't really know what it was then. I went from loving school and doing well in school to really struggling to maintain friendships, struggling to connect with the adults, and also just really losing my way, sort of. And I think that our mental health depends on a sense of connectedness to others. So I had bouts of severe depression, and I would say depression was my baseline. Even when I was happy, I had the sense that that was a temporary state, and I was going to return to this state of severe depression. I became more and more isolated internally and felt less connected to other people and less understood and less loved. Well, I was very loved, but I couldn't recognize it. Another aspect of the dysfunction. And eventually, so then I think I had just turned 28 when I had my sort of most severe suicidal gesture. And I don't even remember being very sad the night before. It was just kind of a normal night. And I went to sleep and I woke up a couple days later in the hospital, totally bewildered. And I didn't know what was going on. And what I heard from my mom and my sister was that I had hung myself, and so it was exactly sort of the thing I had been practicing. I had been hanging for some time. I called my stepdad, who came and cut me down. They called 911, and the emergency response team was there, and took me to hospital. And I don't remember any of that. And the doctors told my mom that my brain had suffered enough trauma from that there was no question whether I would be brain damaged. It was just sort of a question of how much. So.
What was the word? Mental illness. Misunderstanding?
Depression.
Psychology or psychology. The treatment of mental illness.
Okay.
I feel sorry for them.
Someone who's misunderstood.
Great.
Schizophrenia.
I'm thinking about it.
Alzheimer.
Okay.
I don't know that I'm happy to call it an illness.
Right,
All right.
sweet.
You hear me?
Okay, so what is the first word that you think of when you hear the word mental illness?
That's my job.
Oh,
wow.
Okay, yeah, so my name is Terry Cardle. I'm the clinic coordinator here for Child Youth Mental Health. How do we address stigma in mental illness, and how can we, make it like any other health, broken leg, depression? It really shouldn't be valued differently, and because there's a lot of shame, secrecy around it, and it really gets in the way, and it's a barrier really to getting help. If a friend or a peer comes to you and is expressing that they're experiencing a mental health issue, and first thing is that being there as a friend and a peer and being able to listen is huge, because again, you're going to hear information firsthand and really right from the source, so to speak, really more before anyone else, and that fact that you're able to listen and just take in is really important. But don't feel you're alone, because there's a lot of help out for you. And so for us, it's really important to get the word out, and try to sort of destigmatize. And really the best people to do that are yourselves.
with mental health, like, you know, it's hard. It's hard for people to talk about it and be open about it. Certainly, if you have if you have a physical, an ailment that's strictly physical, if you have cancer or something, people are instantly sympathetic. There's no one thinks you should just snap out of having cancer, or no one says, oh yeah, I get that sometimes too, a little cancer, and then you know, and maybe you should just go for a walk, or you know. So I think that just being able to talk about it and just being open, because actually it's like poor mental health is so common, and it was okay just to be how I was, and it was okay to be sad when I was sad, and furthermore that I was in charge of my life, that I could change things. I always had the option to change something radically if I wanted to. I have come to this place by and by where I have begun to accept that how I am is how I am, and that's okay. You know, there's going to be times where I'm down, and there's going to be times where I'm happy, and some of those times will be severe, and some of them will be mild. If you're watching a movie, it doesn't really make sense for every scene to be happy and wonderful. You know, like the journey has to have risk and then danger, and you have to have obstacles to overcome. You know, what I've discovered is that sharing it, or saying it, speaking it, getting it out, never hurts. That has never ever hurt me. It's difficult maybe sometimes to start, but at the end I never feel bad. I never regret it. It never feels like it's cost me something. It never feels like, you know, embarrassing after the fact. But it's when you're hiding it and you feel ashamed, that's when it hurts you. I'm called happy, but I've been one of the saddest people I've ever known at some time.
And left you on your own. And please believe them when they say that it's left for yesterday. And the records that I play, please forgive me for